Healthy bodies regulate blood glucose within 70 to 99 mg per deciliter. In diabetes, this regulation fails due to issues with insulin, the hormone for glucose uptake. Type 1 diabetes involves the immune system destroying insulin-producing cells, leading to insufficient insulin. In type 2, cells resist insulin's effects, and the pancreas may not produce enough insulin. Complications of diabetes include Now let's discuss the clinical presentation of diabetes. The symptoms of diabetes can vary, but common signs include excessive thirst and hunger, frequent urination, unexplained weight loss, fatigue, blurred vision. After knowing all this clinical presentation of diabetes, and we have the instinct that it could be diabetes, and we want to diagnose the patient for diabetes, we the healthcare providers use specific criteria. The most common tests include fasting blood glucose test. This test involves measuring the blood sugar level after an overnight fast. A fasting blood sugar level of 126 mg per deciliter or higher indicates diabetes. We also use the oral glucose tolerance test. For this test, the patient will be asked to fast overnight and then drink a glucose-rich solution. Blood sugar levels are measured 2 hours after consuming the solution. A blood sugar level of 200 mg per deciliter or higher at this point confirms diabetes. Lastly is the hemoglobin A1C test. This test provides an average of the blood sugar levels over the past 2 to 3 months. An A1C level of 6.5% or higher indicates diabetes. These tests are essential in diagnosing diabetes and determining the appropriate treatment plan for individuals. This is the foundation for providing personalized care. Begin by taking a detailed medical history. Ask if the patient has been diagnosed with type 1 or type 2 diabetes, what medications they are currently taking, and any complications they've experienced. For instance, if they've had any diabetes-related hospitalizations or surgeries, conduct a thorough physical examination. Pay attention to vital signs, checking for skin ulcers, lesions, or discoloration on the patient's lower limbs, which could indicate poor circulation or the early stages of diabetic neuropathy. Regularly monitor blood glucose levels. This helps in determining the effectiveness of treatment and adjustments needed. Ensure the patient is taking their prescribed medications correctly. Educate them on proper administration and potential side effects by demonstrating how to use an insulin pen, emphasizing the importance of consistent timing for medication administration, and discussing potential side effects like hypoglycemia or gastrointestinal issues.